Hi there, I'm Kristen, into the Light Healing and Bodywork. This yoga practice was designed as a home exercise program for a person who recently had a hip replacement. It is also beneficial to perform this routine before surgery to strengthen the muscles that will become weak due to surgical intervention. Do check with your surgeon or your physical therapist to determine when it is safe for your body to perform these exercises, and know that surgical precautions are being followed for these exercises. Do not push your body into any stretch after surgery. This exercise program is focused on strengthening more than stretching. We're going to use a blanket and a block and possibly have something near you to stabilize yourself if you need a little help with balance. When you've got all that, we'll get started. All right, friend, we are going to begin laying on our backs. So get there however you can. We're going to first walk our shoulders away from the hips, lift the head, and then put it back down. And then go ahead and straighten out the legs if they're not already. Let the heels be wide apart. Adjust yourself so you're comfortable laying down. And let's focus on breathing here. So sometimes it's nice to have a little cue, a little tactile cue. So touching the belly, trying to bring your breath all the way down into the belly so when you breathe in, the belly lifts up. And then as you breathe out, the belly drops down. Feel free to add a little restriction in your throat, kind of like you're saying, so when we breathe in, nice full breath, we breathe out saying, but we keep our mouths closed when we do that. So breathing in, and then breathing out the ha with the mouth closed. Feel how that's different in your throat. That noisy breath helps to activate your abdominal muscles. See if you can fill up not just your belly, but also your low ribs and your upper lungs. Collarbones rise. And then breathe out. Make sure all the air comes out. Collarbones, upper lungs, lower lungs, belly. And let's bend up one knee, either one. We're going to keep a large angle here, so that it doesn't matter if it's your surgical side or not. And then we're going to tighten the lower abdominal muscles, scooping that belly button in and up, kind of getting a little bit of a rock of the pelvis to engage those abdominals, knitting the low ribs together. And we're going to lift the straight leg just an inch or two off of the ground, and let's point our toes away to activate all of these muscles all the way up the front of the leg. And then let's lower it back down. Let's try again, same side. Inhale here to prepare. Get everything squeezed and tucked, and then exhale, lift. Keep those toes pointed. come back to the breath, using that closed mouth ha sound. Go ahead and let that one down. We're going to bend that knee to meet the other knee, and then we're going to straighten out the other knee. You can even start pointing your toes right now so you don't have to think about it when you're raising it up. And then tuck the pubic bone towards the low ribs, tightening those low ribs together. A little bit of a tuck through the pelvis and tailbone. And then we're going to exhale, lift the foot up 1 to 2 inches above the ground. Try to keep the pelvis nice and stable here. And then go ahead and lower that down. Take a quick rest. Let the body relax. The muscles get a little bit of oxygen, which is why the breath is so important, by the way. And then we're going to exhale, tighten those abdominals again, scooping that belly button in and up, low ribs knitting together, tailbone slightly tucked, pointing the toes, then lift the heel just an inch or two off of the floor, keeping the pelvis bones level. A little bit longer hold this time. Keep stretching your heels towards the wall by your feet or whatever's over there. And come back to the breath. How about one more nice big inhale and exhale here. And then exhale it, lower it down. Good, let's switch sides. Bring that one up and then straightening out the other. And then with this one, we're going to do a bicycle. So as we breathe out, we're going to tuck that belly in and up and bend the knee to meet the height of the other leg. Then we'll just straighten the knee from there, point the toes, and slowly lower the leg down. Before it touches the floor, go ahead and bend the knee up again, just to the same height as your other knee, which is your knees are not straight up, right? And then we're going to straighten the knee and lower back down. Keep a nice long energy going through that leg. And small range of motion. We're just working on building strength here. Breathing out as you lower the leg down. Breathing in as it slides up. And last one on this side here. Good, and then we're going to bend that knee and straighten out the other. All right, doing the bicycle again over here. As we exhale, we're going to bend the knee and slide the heel towards the bottom. As your knee is at the same height of the other leg, we're going to straighten the knee back out, reaching through the toes towards the wall on the other side there, slowly lowering down, and then continuing to cycle. Tight abdominals here, try to keep that pelvis level. And still. And if you really want a challenge, you can come up onto your tiptoes on the bent knee side. It kind of messed up my cycle. And then last one, nice strong pelvis as we lower down. And then release that leg down all the way, straighten out the other leg. Let's walk the heels a little bit apart so they're in the corners of your yoga mat. And we're going to have our arms down at our sides. And then when we inhale, we're going to bring our arms and our legs out to the sides. Arms come all the way up overhead. And then as we exhale, we're going to bring the body right back to the starting position. So make a note of where you are, remembering that your feet are going towards the corners of the mat and they're not straight together. Okay, so ready? On the next inhale, we'll move out to the sides. And exhale, come back in. If you can do this with a little bit of a hover, that's awesome. If not, that's okay. Make sure you got a nice tight tummy going for you. Inhaling, arms out, and exhaling down. To start position. Inhaling, arms out, legs out, and exhaling to start position. Let's do one more here. Nice tight engaged abdominals here. Don't lose it. And then exhale, bring it back together. Legs not all the way together, just to the corners of the mat. And relax the arms and upper body. Feel, notice. Was that hard? It's okay if it was. You just had surgery, most likely. We're going to bring the feet back to a neutral position. And then with these straight knees, we're going to squeeze the buns together. We're going to press the backs of the legs down into the floor. So you're kind of getting a little bit of a lift happening through the lower body. We're going to push on the gas pedal with our feet. Then, while we keep all of this engaged, we're going to use our upper body to reach across or around or just about anywhere you'd like. And as if we're reaching for something, somebody's giving us a gift, and we're going to reach for it and bring it back to center. And you can do this at any angle that you would like. You can reach up high. You can reach down low. If you want, you can reach so low that you have to lift up your upper body. So tuck the chin first, and then put the head on top of the chest and reach across down there. It'll be a little bit harder to do a crunch like that. So tuck the chin first, head up, and then reach across and come back down. You don't have to do that every time. Keep pressing, pressing, pressing into the heels, into the calves, into the backs of the thighs, and squeezing the buns. Changing it up a little bit with each reach. And then let go of all of that you were holding. We're going to bend up our knees. Heels towards the bottom. And hip distance apart. We're going to work on bridge next. First, moving with our breath, and then we'll add a hold at the end. Inhale, prepare to move, and then exhale, squeeze the buns and lift. Inhale, lower down. Exhale, squeeze and lift. Try to keep a nice straight spine for this one. Flowing with your breath. If you want to add some more work, you can lift up your toes and the ball of the foot so you're just on your heels. Try working on slowing down the motion so that you can control any side-to-side movement that might be happening. Maybe let's do one more with the breath. And then we'll hold the next one up at the top. Squeezing the buns. Maybe even pressing the heels a little bit away from the body. Kind of scooches the shoulders up towards the top of the mat. activates the quad muscles. This one's in the front of the thighs. Feel the burn. It's a good sign of muscle building strength. And then lower down when you've had enough. Go ahead and straighten out the legs. And then we're going to roll we're going to roll through the unaffected side, so your non-surgical side, roll to that side, and then we're going to go all the way onto our bellies. If you're not super comfortable on your stomach right now, that's okay. Maybe try putting a little blanket underneath there. That sometimes helps. And hands can go under the forehead. And what we'll do next is a little alternating knee flexion. So just bending the heel towards the bottom and bringing it back down. Depending on the hardness of your floor, you could put a little more power into it, but that's up to you and your environment. So we're just alternating one leg and then the other. The knee is bending and then straightening out with control, fast or slow. And it's also important here to think about the line that your heel is tracing over top of the thigh. So you want your thigh to be kind of like your parallel line of the heel. I don't know if that makes sense. So my heel is coming straight above the line of my thigh bone. And if you notice some weakness, like your leg has to come across the body to come up, that's where we want to try to stop that motion and only do what you can with good quality of motion, even if it's only a little bit of bend. That's okay. You will get stronger. You just have to keep working on it. So nice straight line, heel over the thigh bone and back down. Whatever you can control, however many you can control. Head should be relaxed down on your back of your hands. You can add ankle weights to this as well if it's too easy. And then we're going to switch to doing some hip extension. So to do this one, I like to tuck the toes of the side that you're going to do first. Tuck the toes under, and then stretch out through the back of the leg, lifting the back of the knee up. So the heel is reaching towards the wall behind me and lifting up the knee. Keep that whole back of the leg engaged as the toes lift like an inch or two, not very far, off of the floor, and lower back down. It isolates just the right muscles to really build strength here. Again, trying to keep the head relaxed, and I suggest doing, let's say 10 on one side before switching to the other side. Keep that line of straight length going through the back of the leg. And then when you've gotten about 10 in, go ahead and relax that leg down. Tuck the toes of the other leg. Lift the knee by reaching back towards the wall behind you with your heel. And then lift the toes just an inch or two off of the floor, making sure to keep that knee straight. Do the same amount on this side, however many you got done on the other side. And then go ahead and relax. We're going to do another hip extension. This time we're going to do a little chest lift with it. So Let's start with the left leg. We're going to point the toes this time as if we're pushing on the gas pedal to engage all of the muscles in the lower extremity on the left side. So as that is reaching backwards, we're going to lift the toes and the chest an inch or two off of the floor. Hold it and breathe. Hands can be where they were, or they can be reaching back. Whatever is more comfortable and more engaging for you. Pubic bone is pressing into the ground. And then release down. We're going to repeat on the other side. So right leg, toes are pointing, pushing on the gas pedal, lengthening the leg, and then lift the leg an inch or two up, lift the chest an inch or two up. Arms can be engaged as well. Keep breathing, pushing that pubic bone down into the ground. Squeeze the buns on the right side. And then release. We're going to bring the hands underneath the shoulders here, and it would be a good time if you need a little cushioning underneath the knees. It'd be a good time to get that ready, get it close to you. We're going to press up onto hands and knees with a nice wide angle here, so we're not pushing past your hip precaution of 90 degrees. We'll bring the blanket underneath the torso here. Okay, and then just kind of scoot your body up so that your knees are over top of the blanket. And you can walk your hands away from the body a little bit so that your wrists are underneath shoulders. And we're in a little bit of a plank pose here, so good job. Hold the body nice and tight. We're in a straight line from the knees all the way up to the shoulders, all the way up through the head. One long line, reaching in the same direction. And then let's lower down. We're going to push up into that plank again after a short rest. All right, exhale, tight tummy, pubic bone down, press up. Keep that strong, straight spine. And then lower down. All right, you got this. We're going to do this one more time. Pressing up into a plank, half plank. Exhale. Up we go. And we're going to hold it for 5, 4, 3, 2, 1. Good job. You can bring your hips up just a little bit. And we're going to step the non-surgical side forward into a lunge. And then, with the knee on that blanket there, we're going to just lift up from the toes, lift up onto the knee, and we're going to push forward with that left foot so that it comes towards the right foot, but we want to make sure we're keeping a straight spine and we're not letting that hip bend more than 90 degrees. So the torso has to start to come up before you bring the foot all the way up. Okay, so from there, we are going to go into a standing on the block. So you might need to kick your blanket out of the way and grab your block. If you need to bend over, like I did not prepare my room very well, so if you need to bend over, use that golfer's pickup where you kick your surgical leg back and keep it up in the air and then come back up. So we're going to step onto the block. Let's say our non-surgical leg first. And just go ahead and stand up onto it and keep pelvis level here as we bring the surgical leg forward and backward. Maybe try to lift the toes and then gently place them back down so we're not gripping. Swing that leg forward and backward. And then, keeping the pelvis level here, just try to let a little traction come through that hip. Just for a few breaths, just let the leg relax, while keeping the pelvis level. That's an important piece. And then we're going to bend the standing knee to put weight all the way on the surgical leg. And then we're going to switch. So, stepping up onto the surgical leg, and then just slight muscle activation here, keeping the pelvis level, slight muscle activation to move the non-surgical leg forward and back. If you need to hold on to something for balance, no problem. Chances are this hip has been doing a little bit of extra work since your surgery. So a little bit of hip traction will probably help here too. It helps to stare at something on the floor, a point on the floor to keep your balance. And then we're going to bend that surgical leg to bring the other foot back down. I have used books in the past when I don't have a yoga block nearby for stuff like that. Okay, so next we are going to come into Warrior One. So let's go to the top of the mat. And let's step the non-surgical leg back first. So the step is going to be totally based on how comfortable you are right now. If you need just a small step like that, that's absolutely okay. We are planting our heel down, and we want the arch of the back foot to be in line with the heel of the front foot. For more details on this one, see my Foundations of Medical Yoga poses. We're going to turn, for now, we're going to turn the pelvis so that the front bones of the pelvis are kind of in line with the front of the yoga mat. And we're going to just do about a 50-degree bend in that front knee. So not a super great big bend here, just about 50 degrees. And we want to keep that knee over top of the ankle. Make sure you can see your first, at least, big toe, maybe even second toe, third toe. Okay, so nice tight tummy here. Scoop the belly button in and up. Low ribs are knit together. We can keep hands on hips here. And breathe. For Warrior One, retract the head. Look at the snow falling outside. It's beautiful. And then we're going to turn the feet towards the long edge of the yoga mat. And I'm going to be turning this way. Actually, I'm going to flip around so that you can see me a little bit better. We want the knees to be in line with the second toe of either foot. So like as the knee and the toe are pointing in the same direction, basically. And we're going to have another about 50-degree bend in the knees here. Nice tight tummy. Scoop that belly button in and up. Low ribs are knit together. Really pushing those knees out. Strong, strong, strong through the hips. And reaching the sit bones down towards the ground. Let's inhale. Arms go up in the air. And then as we exhale, we're going to cross the left arm underneath the right arm. And then if you can, get the backs of your hands touching. So, as we breathe in, if you got this, as we breathe in, the arms are going to go up. And then as we breathe out, arms are going to come down. Arms go up as you breathe in. And arms go down as you breathe out. One more time. Great, we're going to uncross the arms. This time, left arm is going to go over top of the right arm, and then backs of the hands together. Or if palms can touch too, that's cool. Make sure, most important thing is that you are making sure that your knees are still over top of the ankles. Go ahead and take a peek if you need to. Inhale, arms up. Exhale, down. Inhale, arms up. Exhale, arms down. Last one, inhale up. Take tummy. Exhale down. And you can release the bind of the arms. And go ahead and turn your toes so that your other leg is in front. So the surgical leg would be in back this time. And double check your hip precautions. There's an approach that you don't want to do hip extension. And if you had the approach, the surgical approach, where you don't want hip extension, don't do this posture. But for normal hip precautions, standard hip precautions, it's okay to do. So we're doing the same warrior two for the other side. We're going to make sure that the arch of the back foot is in line with the heel of the front foot. Just kind of moved through. I think I'm doing this the wrong way. There we go. We're just kind of moved through. You know, because you had a surgical hip. All right. Anyway, forgive me. Turn the torso so that your hip bones are pointing at the front or the back edge of the yoga mat. So you should be facing the back of your yoga mat right now. Reach that sit bone towards the inner thigh. Tight tummy. Hands can be in prayer on your hips or reaching all the way overhead. There's an option to like cross your arms in front of you, grab hold as if you were pulling swords out of your pockets, and bring them all the way up overhead. If you do this one, make sure that your low ribs are not flaring out. You want to make sure those are nice and tucked in. Strong abdominals. Check your knee. Make sure that that is over top of the ankle still and always. And then coming back up to standing at the top of your mat. I'm going to turn to face you. We're going to do chair posture next. Making sure that there's a good amount of space in between the feet, at least hip distance. Okay, so with chair posture, we're going to scoop the belly button in and up. Make nice strong low ribs here. Sit your butt back like it's going into a chair, so your torso naturally pitches forward in order to balance the weight back there. Okay, and then we're going to inhale, arms going to come up. And we just need a little bit of a bend through the knee here. Don't worry about how far you're going. In fact, it's better if you keep it at like 50 degrees to start, 50 degrees at your knee. Knees might be slightly forward of the ankle, but certainly not past the toes. Retract the head. We definitely do not want to have more than 90 degrees of hip flexion here. So that's this angle right here. That should not be more than 90 degrees. If it is, you need to come up a little bit more. And exhale to stand up tall. Okay, next one. Hang in there. We're almost done. You're doing awesome. We're going to build a mountain pose. Nice tall spine, really rooting in through the feet. Again, see my Foundations of Medical Yoga for all of the cues for this one. But really try screwing in the feet, bringing the heels together, activating the legs all the way up. And then we're going to shift weight onto one side and bring the non-weight bearing side forward. And we're going to turn the toes out and then bring them back to neutral. Turn them out, bring them back to neutral. One more time, out and back to neutral. Bring it back here. Switch to the other side. We're not turning the toes in, just to be super abundantly clear about that. Okay, leg forward, turn them out, turn it back in, or to neutral, excuse me. Turn the toes out and then back to neutral. Toes out, back to neutral. Feel how when you turn your toes out, there's a line of muscles activating on the outside of the thigh. Okay, bring it back in. Going for tree pose next. Lots of standing poses because a lot of life is in standing, so we need to strengthen it. Tree pose, we can rest the heel on top of the foot, above the ankle, at the calf, or if you're feeling super adventurous and balanced today, you can try to do all the way up here. I would suggest on your non-surgical, like so your surgical leg would be this one, like if you really wanted to stand on it. It's not a 90-degree angle, but just to get there sometimes you have to bring it all the way up. So maybe even just keeping it a calf for now is fine. And then let's keep our arms down at our sides, relaxed. Turn the palms up. A little balance here. Lift the toes of the standing leg, and then gently place them back on the mat. Come back to the breath. Check in with your posture. Is the pelvis level? Is the belly engaged? The low ribs, are they knit together? If your arms are overhead, it is especially important that your low ribs are knit together. If you need something to keep your balance while you're here, that's absolutely okay. It's kind of fun to notice that as you keep doing a practice, you know, things that you once needed are no longer needed because you're stronger. All right, let's switch sides. Taking a moment to shake that out if we need to. All right, heel to foot, heel above the ankle, or heel up on calf. Just totally dropping that top one. Okay, and then elbows at your sides, palms turned up, or in prayer, or you can grow your branches. Just make sure to knit the ribs. Lift the toes of the standing leg, and then gently place them back down so there's not gripping through the heels, excuse me, through the toes. This is a long one. Good for you for hanging in for this. You're doing great. Way to show up. Come back to the breath. Squeeze the bun on the standing leg side. That can sometimes give you a little extra stability. And lift through the hip. And come back down. The last one might be the hardest one. Kick your blanket back into your knee space on your mat, as long as you don't violate surgical precautions while doing it. We're going to go from a lunge into standing. So we'll start in front of the blanket, and what we'll do is bring the leg back. So be very mindful here about your surgical hip. We do not want to violate the 90-degree hip flexion. Keep the spine nice and straight, and just make sure you know what you're doing as you're going down, so that we don't get too much bend through that hip. So let's bring one leg back, and our goal is to get that knee onto the blanket. So notice spine is straight here, knee starts to bend, and we're in a lunge. Look at that, okay? And then we come back up, lifting up onto the toes and the back leg, and coming back to standing. While our feet, our hip distance apart here, we're going to come up into a heel raise here. Both feet are down, and then we're going to come back down. Other leg this time. We're going to bring it back. Toes can touch first and then come down into the lunge. Come back up, pushing up with the toes. It's okay to have them help you. If you need to hold on to something for balance, that's absolutely okay too. Let's do one more on each side. Just being very mindful about what we're doing at the hip here. I forgot to do the heel raise last time, so let's make sure we get that in. It's a lot to focus on. And come back up. And heel raise. That's that. Good job. Okay, so now we're going to make our way laying onto our backs, however you can get there. And let's go ahead and just, right off the bat, we'll take our heels to the corners of the yoga mat. Move my blanket out of the way for later. So this is your time to recover, to rebuild and restore. Your body just did a lot of work. This practice can truly help to strengthen you. It just takes the effort of doing it and sticking with it, and that's so hard. I'm proud of you for making it to this point. Feel free to have just normal breathing now, being aware of any areas of tension or relaxation or heaviness. Allow your body to sink into the yoga mat. Maybe call to mind 3 blessings in your life, 3 things for which you are thankful. And notice how your body feels as you think of these things. And let your thoughts drift away. Only becoming aware of the present moment, of your breath, feeling of your body on the floor. If you're able to take more time here, feel free to do so. When you are ready, let's stretch our arms overhead. And then we'll roll onto the non-surgical side to push up into a seated position. And pull the blanket so that you can have it underneath your sit bones. Surgical hip can be out straight. No need to bend and contort. Thank you for taking the time to do this practice and for putting in the work. I hope you see the benefits. The light and spirit in me honors and appreciates the light and spirit in you. Let peace be with you.